Why do some people die during sexual intercourse? Deaths related to sex are relatively rare, but they can occur due to a few specific reasons. These causes are generally associated with physical strain, medical conditions, substance use, or other situational factors. Here are some of the most common reasons. Let's delve a bit deeper into each cause and explore the specific conditions and risk factors involved. Heart attack, or cardiovascular events. Sexual activity triggers the release of adrenaline and other stress hormones which elevate heart rate and blood pressure. For someone with coronary artery disease where the arteries are narrowed or blocked, the heart may not get enough oxygen, leading to a heart attack. Individuals with a history of heart disease, hypertension, high cholesterol, diabetes, or those who are overweight, are at increased risk. Men over the age of 50 and postmenopausal women are also more susceptible. Signs to watch for include chest pain, shortness of breath, dizziness, nausea, and sweating during or after sex. For those at risk, doctors sometimes recommend limiting intense physical exertion, including sexual activity. Stroke. Types of strokes linked to sexual activity include ischemic stroke, which is caused by a clot that blocks blood flow to the brain. Blood pressure spikes during sex can increase the risk of clots forming or dislodging. Hemorrhagic stroke, on the other hand, is caused by a ruptured blood vessel in the brain, often linked to high blood pressure or aneurysms. Sex-induced spikes in blood pressure can cause weak blood vessels to rupture, resulting in bleeding in the brain. Risk factors include high blood pressure, atrial fibrillation, smoking, excessive alcohol use, and obesity. People with undiagnosed brain aneurysms are particularly vulnerable, as the exertion of sexual activity can lead to a rupture. Aneurysm rupture. Common sites for aneurysms are the brain and the aorta. A brain aneurysm, if it ruptures, can lead to a hemorrhagic stroke, while an aortic aneurysm can cause massive internal bleeding. The surge in blood pressure and stress during sexual climax can place additional strain on an aneurysm, potentially causing it to burst. This can lead to a sudden and severe headache, loss of consciousness, or even death if not treated immediately. Regular medical checkups, especially if there is a family history of aneurysms, can help detect these before they become life-threatening. Respiratory issues. Conditions impacted. People with asthma, COPD, or pulmonary hypertension may struggle with breathing during sexual activity due to the increased oxygen demand. Asthma attacks can be triggered by exertion, leading to shortness of breath, wheezing, and potentially respiratory failure. Managing the risks. Asthma sufferers should use an inhaler before sexual activity if needed, and people with COPD should pace themselves and avoid positions that may restrict breathing. Substance use. Stimulants and cardiovascular risk. Drugs like cocaine, methamphetamine, and ecstasy, also known as MDMA, increase heart rate and blood pressure to dangerous levels, putting users at risk of heart attack, stroke, or aneurysm rupture. Cocaine in particular is associated with sudden cardiac events as it constricts blood vessels and increases the workload on the heart. Alcohol and sedatives. Excessive alcohol or sedatives can depress breathing, impair reflexes, and reduce awareness, making it easier to accidentally suffocate or fall into dangerous positions without realizing it. The combination of alcohol with other drugs can also lead to respiratory failure. Risk of overdose. Certain substances, particularly opioids and sedatives, can suppress respiration to a life-threatening degree, especially when combined with the physical strain of sexual activity. Positional asphyxiation. How it happens. Positions that place pressure on the neck or chest can restrict airflow or blood flow. This includes not only certain sexual positions but also activities involving bondage or restraint, which can lead to accidental suffocation if not carefully monitored. Autoerotic asphyxiation. This involves deliberately restricting oxygen to enhance sexual arousal. If done incorrectly or without a safety mechanism, it can quickly result in unconsciousness and ultimately death due to lack of oxygen. Precautions. If engaging in any activity involving restraint, it's crucial to have a safety plan, such as a quick release mechanism, and ideally a partner who can monitor for signs of distress. Physical trauma. Common injuries, falls from high surfaces, Head injuries from hitting objects, or even fractures due to sudden or awkward movements can occur. People can injure themselves when attempting unusual positions or using furniture not designed to support movement. Risky locations, engaging in sexual activity in unstable or slippery locations like bathrooms, staircases, or vehicles, can increase the chance of accidental falls or injuries. Prevention, simple measures like clearing the surrounding area and using stable furniture can help reduce risks. Trying new or adventurous positions should be done with caution, especially in unfamiliar environments. Allergic reactions, potential allergens, latex condoms, lubricants with fragrances or preservatives, and certain topical creams or products used during sexual activity can cause severe allergic reactions in sensitive individuals. Symptoms of anaphylaxis, swelling of the face, lips or throat, difficulty breathing, hives, and rapid heartbeat are common signs of a severe allergic reaction. If untreated, anaphylaxis can lead to shock and death. Preparation and safety for people with known allergies. Avoiding products containing allergens and having an epinephrine auto-injector or EpiPen on hand can be life-saving. In general, while these risks exist, they are rare, and most people experience no severe consequences from sexual activity. Those with underlying health conditions should consult a healthcare professional to discuss any potential risks, especially if they experience symptoms like chest pain, shortness of breath, or severe headaches. Contributory factors to sex-related deaths. Age-older adults, particularly those over 50, are at a higher risk due to the prevalence of underlying cardiovascular diseases. Health conditions, heart disease, high blood pressure, diabetes, respiratory diseases, and obesity significantly increase risks during sex. Physical fitness, lack of regular physical activity, or poor cardiovascular fitness can increase strain during sexual activity, potentially leading to cardiac events. Emotional factors, anxiety, stress, and guilt, particularly in extramarital or secretive encounters, can increase adrenaline levels, raising blood pressure and the likelihood of cardiovascular incidents. Time of day studies suggest that sex-related cardiac events often occur in the morning, likely due to increased adrenaline and blood pressure levels naturally occurring at that time. Sexual activity with new or multiple partners. The excitement or stress of sexual activity with a new partner can increase the strain on the heart, especially in those with pre-existing heart conditions. Research, facts, and figures. According to a study published in the American Journal of Cardiology, sudden cardiac death during sex accounts for about 0.6% of all sudden cardiac deaths. This indicates it is relatively rare but does happen. Research indicates that approximately 82 to 93% of sudden cardiac deaths during sex occur in men. The average age of men who experience these deaths is typically around 60. A German study on sex-related deaths found that heart attacks were the leading cause, followed by aortic aneurysm rupture and respiratory failure. Around 50% of cases involved extramarital sex, suggesting a potential link between secretive or stressful situations and cardiovascular strain. While drugs like Viagra and Cialis can help men with erectile dysfunction, they can increase the risk of heart attack in those with heart disease if combined with nitrates or other blood pressure-lowering medications. Symptoms to watch for during sexual activity. Chest pain or discomfort may feel like pressure, tightness, or squeezing, and is a common warning sign of a heart attack. Labored breathing or an inability to catch one's breath, particularly if accompanied by other symptoms, should be taken seriously. Feeling faint or unsteady can be a sign of inadequate blood flow to the brain. Unexplained nausea, sweating, and cold sweats can signal a heart attack or other serious issues. A sudden, severe headache could indicate an aneurysm rupture, especially if it's described as the worst headache ever experienced. Prevention tips and safety considerations. Those with existing heart conditions, hypertension, diabetes, or other significant health risks should consult with their doctor about the safety of sexual activity. Regular exercise improves cardiovascular health and can help reduce the risks associated with physical exertion. Avoid the use of stimulants or excessive alcohol, as they can increase the risk of cardiovascular events and impair judgment. Engage in sexual activity in stable and familiar surroundings to minimize risks of falls or accidents. If allergic to latex, consider alternative materials like polyurethane or polyisoprene condoms, and avoid products with fragrances or harsh chemicals. Medications and considerations. Erectile dysfunction medications like sildenafil, Viagra, and tadalafil, Cialis, can pose risks, especially if combined with nitrate medications used for heart conditions. This combination can cause a dangerous drop in blood pressure. Beta blockers and blood pressure medications can lower heart rate and blood pressure, which may decrease the strain on the cardiovascular system during sex, but can also reduce libido and sexual performance. For those with asthma, using a quick relief inhaler before engaging in sexual activity can help prevent an asthma attack. Those with severe allergies should have an epinephrine auto-injector nearby in case of a sudden allergic reaction. Prevention through lifestyle and health management. Regular health screenings such as blood pressure, cholesterol, and blood sugar checks can help monitor for conditions that increase cardiovascular risk. Practices like mindfulness, meditation, and deep breathing exercises can reduce stress levels, which may help lower blood pressure. Smoking damages blood vessels and increases the risk of cardiovascular disease, stroke, and other health issues, so quitting smoking is essential. Maintaining a healthy weight can improve cardiovascular health and reduce the risks associated with exertion during sex. In summary, while deaths during sexual activity are rare, they can occur, particularly among those with underlying health conditions or other risk factors. Regular medical checkups, physical fitness, and avoiding risky behaviors can significantly reduce these risks. Those on medications or with specific health concerns should seek guidance from their healthcare provider to ensure safe and enjoyable sexual activity. If you found this video helpful, don't forget to subscribe to this channel for regular health tips and updates to stay informed about ways to improve your overall well-being. Thanks for watching.